Hi,
Hi,
everyone.
everyone.
Welcome back to another episode of Can We Discuss with Yara and Petra.
Today, we're joined by our dearest friend and our favorite dermatologist. I'm sure you know by now, Dr. Samar Khalil.
Hi, happy to be back.
We're gonna be bringing her back for every season of life.
Yes.
And today, we're going to be discussing skincare during pregnancy.
Yes. Samar, congratulations. You're expecting your first baby girl. We're so excited for
Thank
you.
you. Thank you so much.
And it makes for a perfect time for us to talk about pregnancy and skincare. Obviously, we already had an episode with you before where we touched on Botox and fillers. So now it's going to look a little bit different, but we're so excited to have you. Um,
So excited to be here.
thanks for joining. So, everyone always says pregnancy glow is real, okay? But we also hear about like a lot of the not so glowy stuff. So, my
True.
question to you is what are the most common skin changes you see in pregnant patients?
Okay, so first, let me tell you, first trimester, there's no glow. You're tired, you're miserable, you look horrible. But then, to be fair, in the second trimester, you start to feel like yourself again. One of the nice things about pregnancy is because of the increased blood flow, your skin looks radiant. That's why we call it the pregnancy glow. The
Yeah.
blood flow increases, your skin looks nicer, your hair looks nicer, there's more volume, it looks healthier. Then we'll talk about what happens after you deliver to the hair. This is the good side of pregnancy, but there are some other changes. Some are not necessarily bad, but maybe different. So, first, one of the most common concerns is dry skin and itching during pregnancy. We see this a lot, and this is why we recommend you start moisturizing from the early days. One, to combat dry skin and itching, and two, because you want to try to prevent stretch marks. We'll talk about this more in a bit. Another thing we see is pigmentation, whether it's on the face, we call it melasma, or even mask of pregnancy. It has a name for pregnancy. We see it in intimate areas, the underarms, the intimate areas. There will be basically increased melanin production because of the hormonal changes, and so they will become darker. We see this mostly in patients with darker skin already. Of course, we all know some women get stretch marks. A lot of the changes that actually happen, they occur late in pregnancy. But it's important to start taking care from the early stages.
To kind of prevent some of these things
Exactly.
happening.
Exactly.
Okay. Yeah.
Okay. So you already touched on stretch marks, Shway, but let's dive into this. Is this something that's inevitable? Is every skin type prone to stretch marks? And what actually works to prevent or like minimize stretch marks?
All right, so not every woman will get stretch marks.
Okay.
It's primarily genetically determined.
Ooh.
It would be good to ask your mom, your grandma if they had stretch marks. It's not necessarily if they had it, you're not gonna get them for sure, but it increases your risk.
What about ammetic?
My mom didn't have them, so I'm so happy. My aunt, actually, I'm not sure, but I don't, they never mentioned it. So I think I'll be fine, but let's see.
Okay.
So genetics is the most important factor, but
Yeah.
we do believe that moisturizing the skin might help. There's
Okay.
nothing proven 100%, but we do believe it might help. For the ingredients, I mean, there are so many popular products. We're not going to name them, but nothing is 100% proven. There was one systematic review, which means it's a big study that assessed multiple studies, and they found that maybe hyaluronic acid and something called Centella asiatica might help. So if you want to get a moisturizer anyway, get one with either hyaluronic acid or Centella asiatica. Some doctors recommend, I always pronounce this wrong, but that's how I pronounce it, shea butter, vitamin E, cocoa butter. I mean, whatever. For me, as long as you're moisturizing, you're good. And try to massage while you're applying it as well.
I've been using an oil called Bear Blend.
Mm-hmm.
It's a mix of natural oils.
Uh-huh.
There's vitamin E, jojoba oil. olive oil, a bit of carrot oil, if I'm not mistaken, but it's all natural products.
Okay,
So,
but I want to point to something that sometimes essential natural oils, not the ones you mentioned are fine,
yeah.
but some essential oils can actually be quite irritating and even induce eczema, especially
Yeah.
during pregnancy where you have increased skin sensitivity.
There was one oil that I used actually that did do that for me. It wasn't during pregnancy or anything, it was before, but it did do that for me. It caused dryness and itchiness.
Because people assume, oh,
It's
natural,
natural,
it's safe.
خلاص.
But it's not
Yeah,
the
yeah, yeah, yeah,
reality.
yeah, yeah. Yeah, I get that. The
Wow.
oil helps or makes me massage my body a bit more,
That's
right?
good.
With
That's
the
good.
lotion, I feel like, okay, خلاص حطيته ومشيت.
Look, as long as you're applying something and moisturizing and massaging, I'm fine with it. And again, there's nothing proven, so
Yeah.
but we still recommend we do it.
I mean, it's like when you're not pregnant, you have to
It's true,
moisturize. Don't
true,
forget to moisturize your
true.
body. So
Yeah.
Yeah.
أنا كمان هيك I'm not pregnant بس أنا يعني like we have to clarify on this episode بس أنا for example like مثل ما عم تقول يارا إنه I just think like you قبل I used to just moisturize like my legs and my arms, you know, I would think like body parts that are eventually going to show or be exposed بس هلا صرت even my entire body like my stomach my back كله I make sure إنه I always moisturize after the shower.
Very
تحسي عن
good.
جد it makes a difference يعني in like the appearance of your skin, so it's like really cool to see.
It does,
um
especially Petra, you move to a colder area, so your skin tends to become more dry.
yeah, very much colder area يعني putting it nicely. طيب, one other thing that I see a lot of like back and forth on social is hormonal acne during
Yeah.
pregnancy. Is this just something, Kamena, that's genetic, maybe same as stretch marks, or is this just something like expecting moms need to expect and then just fee any like safe treatments that people can look into?
Yeah, so when it comes to acne, some women already had acne and it actually improves during pregnancy. For others, unfortunately, it becomes worse or it appears during pregnancy because of the hormonal changes, but it's a bit unpredictable. We cannot predict it. But there are, of course, not the strong acids that we use when a woman is not pregnant. We cannot use them during pregnancy, but there are some safe options. For example, azelaic acid is one of my favorite ingredients to give during pregnancy in general. One, because it targets acne, but two, because it also targets pigmentation, it targets rosacea or redness. So it targets so many things and it's completely safe. Niacinamide is another ingredient. My podcast co-host hates it because he thinks it's overrated, but I personally like it as not as the star ingredient, but as part of the formula. I think it's a nice ingredient to have as well because it has so many other benefits. Some topical antibiotics may be used, but some women are resistant to it. I mean, we do have options, but I would say if you're having acne, go to your dermatologist, let them examine. Sometimes there are some safe even procedures like cleaning if there aren't too many lesions that we can do. This would help as well. So visit your dermatologist for sure.
I know some of my friends هيك come in, they only started dealing with acne when they got pregnant, and it was like a little bit هيك harder for them. I think one
Yeah.
of them راحت عند the doctor, and at first she was asking her if she can do laser. بعتقد انه this is a no go,
no,
right? When you're
no.
No,
pregnant.
lasers are not actually studied in pregnancy. We recommend to avoid them. Even laser hair removal, we get this a lot. We don't know. Some ask me like, why would it matter? They're right because some lasers are very targeted. For example, laser hair removal targets specifically the hair, the melanin in the hair. But it's not studied, one, and two, because of the hormonal changes, you might do it and then you're not getting a result
Yeah.
because for
مزبوط.
example, patients who have PCOS or hormonal fluctuations, you do laser hair removal, you pay money, and then in many cases it doesn't work if you're not treating the PCOS.
Yeah.
The same thing applies to pregnancy. Plus, as we said, there is increased skin sensitivity, so you're just worried maybe they would react, and if they react, how are you going to treat them if you need to apply steroids? You don't want to use medications that you usually avoid during pregnancy, you know?
Yeah. I think, I mean, just in general, if it's something that you don't have to do,
Exactly.
just don't do it. It's okay,
Exactly.
especially if there's not a lot of recent studies about it, right?
True. I mean, there won't be studies because imagine you're pregnant and I tell you, oh, come, let me try to see if it's safe or if it will harm your baby or not. No one's gonna do that. It's not ethical.
It's
So
like
that's why.
smoking when pregnant now.
True, true. That's why we may never know, but better be
So,
safe than sorry.
Yeah,
yeah,
yeah, I get
100%.
that honestly, and it's okay. It's just 9 months. You can
True.
stop eating sushi for 9 months. You can
True.
stop doing Botox.
But I'm craving it, Tiara. I'm craving it.
I think one for me is the
Um,
Botox.
I don't. I don't know how both of you guys are doing it, Saraha. No, for me, sushi is gonna be something so hard to give up when and if I get pregnant, inshallah. عن جد شي ما بعرف كيف. Yara, you just said Botox is hard for you to give up during pregnancy. Samar, what's something for you in skincare, Kamena, that you're giving up now that's hard?
Look, I mean, to be honest, I feel we were just talking about this with Yara. I've always done my Botox regularly, every 5 to 6 months, and now
Yeah.
my Botox is completely gone. But I'm actually okay with it for some reason. I'm embracing it. Maybe because the last Botox I had was a bit stronger than what I like, so now I'm just happy it's gone, and I just want to detox, you know. But
Yeah.
yeah, so if we want to mention the procedures. Botox, we definitely don't recommend. Fillers, we don't recommend. Some ask me why, because fillers is hyaluronic acid, which is supposedly safe.
Yeah.
Just because there are other ingredients with it as well in the filler. We don't, and again, no studies.
Also, it's getting injected inside. It's not a
True,
topical thing,
true,
right? So,
true. But still, I mean, in theory, it's a safe ingredient.
yeah,
But again, there are other
reasons.
additional ingredients in
Okay.
it. Chemical peels, most of them aren't. Some mild ones may be used. Microneedling is okay because you're basically just using needles as long as you're using serums that are safe.
Okay.
But again, here you think, is it really necessary?
Yeah.
What if you get an infection? Then
Yeah.
you might
صح.
need to take antibiotics. So it's like you think about it this way, you're like, it's okay, I can wait.
I can wait. Anything,
Yeah.
everything can wait.
Yeah.
Everything can wait.
Yeah.
What about retinol? That was a big one that I was very confused about when people said you can't do retinol.
Yeah, so retinol or retinoids in general, vitamin A derivatives, are contraindicated in pregnancy.
Okay.
If absorbed, they may lead to birth defects. So we prefer not to,
Oh, wow.
even though honestly studies have shown that there is very minimal absorption from
Okay.
topical use. We know for sure that oral Accutane or
Yeah.
Accutane are not, definitely not safe.
Okay.
The topical ones, even though the likelihood of absorption is very low, we still recommend you don't use them.
Okay.
Another ingredient which is not safe is hydroquinone, which is a very popular ingredient, at least here in the Middle East, for pigmentation. So this one you definitely cannot use. When it comes to other acids, for example, salicylic acid above 2% is not safe. Below is okay. Salicylic is commonly used for acne, for oily skin. So
Okay.
if it's below 2%, you're okay with using it. Glycolic below 10% is fine. What else? Niacinamide is fine, as we said. Azelaic is fine. Am I talking Chinese?
No, not at all. Not at all. I feel like everyone is now they ask all of these questions because
صح.
TikTok, Instagram, social media, everyone
True.
talks about all of these things.
True.
So
Yeah.
where in the past this was something that only dermatologists would
True.
understand.
By the way, we just, because you know we have the other podcast, we
Yeah,
posted
yeah.
a reel with many ingredients, and
Yeah.
people keep commenting these weird ingredients that I have to look up. People like now are aware of so many weird ingredients, and I like the awareness, but at the same time, it's too much.
It's a bit much. Yeah, I can, honestly, I see videos and I'm like, okay, but you don't need all of this skincare.
True.
And sometimes
Yeah.
people look at me and go like, oh, what do you use? And I'm like, actually, my dermatologist said I can only use, like, I don't have to use anything. I can use only moisturizer.
I'll tell you what I'm using now in pregnancy. I'm
Yeah.
washing my face for sure.
Yeah.
I'm using sunscreen every single day. At night, as I said, I love my azelaic acid, so I'm using it. Sometimes I use a serum with a low percentage of salicylic. I was getting a few breakouts at the beginning, but now it seems to be controlled. Sometimes I'll get a serum with hyaluronic that I'll from a drug company that I'll try, but the most like products that I'm using most consistently are my sunscreen and my azelaic acid,
Yeah, and I
and
mean,
of
it
course the
depends.
moisturizer.
It
Yeah,
depends on the person's skin type as well,
true,
right?
true,
So,
true.
Yeah.
see, even from a dermatologist, you don't need a million products on your face.
Keep it simple, especially during pregnancy.
Yeah, I know. I'm not pregnant. I keep it super simple. يعني I literally just wash my face and just put moisturizer on. بركي أوقات بالليل يعني أو بالليل أو الصبح. That this is how not often I use it. بحط vitamin C. But
Yeah.
other than that, ما بعوز شي. I just,
Vitamin
go.
C is safe, by the way, in
Oh, it
pregnancy.
is for pregnancy?
Yeah,
Nice.
yeah.
Okay, interesting. طيب, you already touched on so many different ingredients that we need to avoid or that are safe during pregnancy ومثل ما قلت انه it's so funny عن جد كيف هلا on TikTok صرنا انه everyone's exposed to so many random ingredients. انا من الاشخاص اللي عن جد انه ignorance is bliss, like I don't want to know any of these names, so بترك حالي هيك شوي a little bit distance from all of these things. طيب, so if there's a specific ingredient that you think is the top one, is it moisturizer for when you're pregnant, something هيك for skincare?
Sunscreen, for
Sunscreen.
sure, sunscreen.
Sunscreen. Okay,
Because
how
as
come?
we said, pigmentation is more common when you're pregnant, and the
Oh,
melasma, which is the which we call also the mask of pregnancy, is
okay.
can be difficult to treat, and sometimes it resolves after giving birth, but sometimes it stays. So if you really want to
Uh,
prevent pigmentation, sunspots, all of that, definitely use your sunscreen. There are
okay.
two types of sunscreen. There's the chemical sunscreen and the mineral sunscreen. The chemical sunscreen, personally, I do think it's fine to use it, but some recommend using the mineral sunscreen just because there is a fear of absorption of the chemical sunscreen. It
Okay.
hasn't been associated with anything harmful in humans yet, but if you want to be on the safe side, you can go for a mineral sunscreen. They tend to be a bit thicker. The old formulas used to leave
Mm,
a white cast,
I
which
remember
people
those,
didn't
yeah.
like. However, there are some new formulas, new brands that really have some very, very nice physical sunscreens.
Yeah.
Is there any specific sunscreen brands that you do want to talk about and that you want to recommend?
I mean, if we're this is no ad. I don't
Yeah.
deal with these companies, but for the mineral sunscreen, there's the PCA Sheer Mineral Sunscreen, which is really nice.
Okay.
There's the Elta MD, which is very popular in the States and it will soon be available in UAE. Actually, they have very
Interesting.
nice mineral sunscreens. There's
Okay.
the SkinCeuticals one as well. These are
Yeah.
the ones, honestly, that because I don't use it, I cannot tell you, but these are
Yeah.
the ones that patients tell me are not heavy and they actually like them.
Okay,
Interesting.
nice.
That's good to know.
Yeah. Yeah, it's like taking notes. Um, طيب, حكينا عن like procedures like Botox and fillers, for example. What about things like skincare treatments, مثل facials, مثل other professional skincare treatments? I don't,
Profilo.
Profilo,
So,
like,
so Profilo is a type of skin booster. Skin booster is hyaluronic acid, but it also has other ingredients with it.
Okay.
We prefer to
okay.
avoid facials. I mean, sometimes they use acids in those facials. If the acids are low percentage, then it's fine.
Okay.
If they are higher percentages, then no, I prefer not to.
Okay.
What else? Cleaning of acne is okay.
How about
Okay.
scrubs? The scrub that you would buy and use at home
It's fun. It's just in general, I don't like
because
scrubs.
they're
I prefer
harsh. Yeah.
gentle chemical
Yeah.
exfoliation. Remember, in pregnancy, your skin will be drier and more sensitive, so you
Mm,
don't want
You don't
harsh
want to scrub
scrubs.
it. Yeah, yeah, yeah.
If it's a mild one, it's fine, like once per week. Yeah.
Okay.
okay.
Fair enough.
وأكيد أكيد يعني this is something you always have to disclose to either your dermatologist or الesthetician that you're doing all of these treatments, even early on.
But actually, as dermatologists, we're one of the, or as doctors, we're one of the first people to find out that the person is pregnant before they
Yeah,
tell their
before they tell
family.
anyone.
Before, so it's a
مظبوط.
nice, it's nice for us to share this moment with the patient.
صح.
Because
That's
خلص, they
cute.
have to. They
They
have
have
to
to tell
tell you.
us,
Yeah, yeah, they have to tell you.
yeah.
لا, it's cute. طيب, so we said your skin becomes a lot more sensitive and it's proner to become drier, maybe a little bit itchy. So in terms of like the most effective way to soothe it, عم نحكي really just moisturizers, right?
Also, and this also applies to outside of pregnancy. You also want to avoid very hot water in the
Oh,
shower.
Okay.
avoid harsh loofahs, which strip
Mm,
off these natural oils. And yeah, moisturize after the shower.
okay.
So is it
Oh,
true that if you drink more water, your skin will be better?
Unfortunately, it doesn't affect the hydration of the skin.
Okay.
Most patients
oh.
come to me, doctor, I have very dry skin, even though I drink a lot of water. It's not about drinking water, it's about using a moisturizer.
Okay.
But drinking water is very important for sure for
I
your
mean, in
health.
general,
Yeah,
health. Yeah, yeah,
yeah.
yeah, yeah.
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 Yeah. Do you have a preference when it comes to مش facial care عم أقول مثلا إنه the rest of your body, do you have a preference to lotion based versus like an oil based moisturizer ولا بتحب اتنين you don't mind?
I prefer lotions, to be honest, and I'm
Okay.
using the same one I'm using for the stretch marks
Yeah.
for my
Okay.
whole body. It's basically a
Oh,
moisturizer, so why
Yeah,
not?
it works. Why
Yeah.
not?
okay.
To normal
Okay.
moisturizers يعني إذا في حدا عم كل حياته عم يستعمل a moisturizer في ضلوا عم يستعملها ولا
Yeah.
there's something that they need to consider.
No, and some, I mean, some have anti-aging ingredients in them,
Okay.
so you don't want to use those.
Yeah.
But in general, most are okay. I would just check with the derm. Sometimes there are few
Some
ingredients,
ingredients.
yeah. But
Okay.
in general, moisturizers are okay.
Okay. Fair
So
enough.
we don't want to use anti-aging ingredients يعني أنا أكيد my moisturizer I can't use it if I'm
No, I mean
pregnant.
because some have low percentage retinol, for example.
Okay.
You just want to make sure, just show the ingredient list to your dermatologist. Just make sure everything is fine.
Most of the products that are pregnancy safe كمان هلا صاروا بيحطوا يعني there's a icon, a symbol on the product that says safe for pregnancy ما هيك؟
Yeah, but some are safe and it doesn't say on the product
Oh,
because they're
okay.
not marketed for pregnant women.
Yeah.
Okay.
Yeah,
Yeah,
بيكونوا
that
their
makes sense.
products you can use for always بس إنه
exactly.
ثابت when you're pregnant you also want to use it يعني.
Yeah.
Yeah.
طب what are some things that some patients come to you and they're shocked that it's a no-no during pregnancy?
Laser hair removal is one of them. What else? I don't know. It's mostly these kind of things: laser hair removal, Botox and fillers. Some don't know actually.
One thing I was shocked about is even when you're breastfeeding, you shouldn't do Botox.
The thing is, there are no studies, and again, the risk of absorption is very low. Some do it, to be honest with you.
Yeah.
Some do it and then they breastfeed immediately. Some do it and then they wait few hours before breastfeeding.
Okay.
They dump like the
Fine.
first.
Yeah, yeah,
It's controversial. I think it comes personally what I tell them because I don't want to take the responsibility.
yeah.
Ask your pediatrician. If they said it's fine and you're okay with it, then it can be done. Just know as a doctor, it's my responsibility to tell you there are no safety data on
Okay, so
the
there are risks associated, just like
yeah,
everything
yeah,
else. Okay.
yeah,
Or
Okay.
there could
Yeah,
be
so
risk
that was a big one
associated.
for me that I'm like, oh, really? I had no idea. يعني أنا
yeah,
ما كنت عارفة إنه هيدا الشيء
yeah,
is part of it.
yeah.
Yeah, it's like I
But
have to
yeah.
wait more than 9 months now. يا الله. طيب what I want us to debunk one pregnancy skincare myth. What's like the craziest thing that you've heard and what's the real science behind it?
This one is not it's more after giving birth. It's not a myth. It's actually the truth that breast milk can help with cracked nipples
Oh,
during
that's
Ooh.
true.
breastfeeding. So what they usually recommend is that you apply the breast milk on the nipple,
Okay.
you let it dry, and then you apply a cream rich in lanolin, for example. It will help the irritated nipple to get better.
And that's scientifically
Yeah,
proven.
yeah, yeah. It has
Wow.
Oh wow.
anti-inflammatory, antibacterial properties.
Oh yeah, and I've seen انه بيحطوا البريست ميلك اوقات بيحطوه in ice cubes وبيمسكوا الايس وبيعملوها انه they freeze the breast milk وبيمسكوا الايس
Really? Oh my god, that's new
Yara,
to me.
Yara, I was literally
I
just
don't
about to
I
say that.
wouldn't do that, but but interesting. Where do you see those videos?
Yara, I swear to God, I was about to say the same thing. أول شيء أنا my
What?
Instagram algorithm أكيد thinks I'm pregnant وأكيد thinks I have children. So بضلوا بيطلع لي أشياء هيك وهيدا كان شيء كتير بيطلع إنه if you put it apparently it helps with your skin firmness and like boosts the glow if you freeze the
It's
breast
baby
milk and instead of
Botox.
icing it.
Guys, don't apply ice directly on your face, whether it's water or breast milk. Put it in a like a cloth or something, and then you fine do whatever you want to do.
Samar, I
والله
Samar, I do that. I apply an ice cube directly on my
You
face.
should not. You should not because extreme cold is also not good for your skin. So put
Okay.
it in like I don't know in
Hey,
something.
yeah, I should get
Microfiber.
like a regular
Yeah,
ice roller
هيك.
like normal humans, but أنا هيك إنه
yeah.
I don't use it often. So when لما أحس حالي إنه I'm puffy, I'll just grab an ice cube out of the freezer and just like roll it under my eyes.
Just be careful. Be careful. It can really harm the skin.
Okay, okay, fine. So yeah, so I guess then that's a myth, the breast milk, frozen breast milk on your face. I was
On your
totally gonna
face.
have yeah, I was totally gonna have you, yeah, to give me some breast milk to use.
Not weird at all.
No,
No,
Petra,
no,
not
no.
at all. Not at
It
all.
anyone who knows me knows that would never be a weird request from me. All of my friends, like I've tasted some of my friends' breast milk, and some of my friends who have kids.
I
Really?
would never.
Yeah,
I would
Really?
never.
How does it taste?
so sweet, by the way. Like it tastes so sweet عن جد
حسب شو
يعني.
اكلين بترا، حسب شو اكلين، شكلهم اكلين مغلي كتير.
ما بعرف صراحة, بس all I know is that it was like super super sweet and it tasted good,
Interesting.
honestly.
All right.
God, you think so?
This podcast is going into
A whole other
Petra
direction.
territory. Petra weirdness territory.
On Shed. But some of my other friends don't let me taste their breast milk. They're like, "No, why? You're so weird." I'm like, it's cool. It's interesting. But okay, anyways, so now that you're experiencing pregnancy firsthand, okay, has your
Yeah.
perspective on skincare changed at all? I mean, انت كنت already تقولي انه ما ضروري هالقد to overcomplicate it, but has it changed and what are you finding the most challenging?
To be honest, regardless of skincare, I learned to respect pregnancy more, and I wish I was there. I mean, I was there for my friend when she was pregnant, but I wish I was more available to her because it's really difficult. I mean, every journey is different, but for me, the symptoms, the nausea, the fatigue, you really the first trimester. Honestly, you don't think about skincare. You just think about surviving. It's really, and I'm not someone Yara knows. I'm not
Yeah.
someone who nags, or when I'm sick, I just go out and I go to work.
Yeah.
But really, it gets to you. For me, it's the nausea. It's the worst feeling in the world. After the first trimester, that's when you start to feel like yourself again, and that's where you feel like, oh, I am ready. I want to take care of myself. You might go to the gym again, start working out again, and of course, you don't want to neglect your skincare. To be honest, it hasn't changed skincare wise. I'm just being more careful with my sunscreen, more careful when I'm outdoors, not to be directly under the sun,
Exposed.
exposed to the sun. I'm definitely not going to tan this summer. I don't tan, but I mean, I'm definitely not gonna go to the beach and
Yeah.
just sit under the sun.
Yeah.
Yeah, you just you're more careful.
Yeah. Damn, that's hard, guys. You're not gonna tan? Yara, you're not gonna tan this summer?
I already switched to one pieces when I go to the beach now. I'm like, okay, يمكن أحسن ما بعرف. It's nothing, but it's a little piece of cloth. But I'm like, maybe.
I mean, it's better, and also please be very careful because again, these changes, the pigmentation, they appear
Later
late.
on in the
Yeah,
pregnancy. Yeah.
so be
Yeah.
careful.
Okay.
Yeah, I
Damn,
think there are
guys.
some things that ما ضروري ما مضطرين عليهم. Tanning is one of the things that is not necessary in general, especially when you're at a higher risk of getting some skin مش diseases بس إنه some hyperpigmentation in your face, some things that are maybe going to be reflected or affect your skin maybe later on even after your pregnancy. So I think there are some specific things you don't have to do. I mean, everything can wait. It's 9 months. Everything can wait.
True.
Yeah. I think I
I
would take
agree.
like summer's route, Sata. Like if I'm not tan, you'll never catch me on the beach. So بقعد بالبيت بنضب. تعودت هلا لما صرت بأمريكا إنه أكون كتير بيضة. بس
Oh,
إنه
wait,
under the
that's actually
clothes.
another that brings a question to my head. The self-tanning lotions at home, are those pregnancy safe?
Interesting. I haven't checked. I'm not sure. It usually contains something we call DHA. I need to check this. I'll get
Interesting.
back to you guys.
And DHA,
Yeah.
is that a no-no for pregnancy?
I'm not sure. That's what I need to check.
Interesting.
Yeah,
Okay.
that's
Okay.
what I need
Yeah.
to check.
We'll get back to you guys on that one.
Yeah, that's another one. I was gonna ask you, Samar, and what's your number one piece of advice for expecting mothers when it comes specifically to their skincare? Am I hearing no sunscreen, 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 and avoiding the sun, or
To be honest, yeah, just because it's the thing you can actually avoid.
Son.
So apply your sunscreen, avoid the sun. Be as consistent as you can with your skincare, but as we said, keep it simple.
yeah. Okay. And then outside of skincare, what are some other like lifestyle changes that you recommend for healthier skin during pregnancy? Yani Yara touched on hydration. Is it diet? Is it sleep? Yani what is something that barat products we can control?
Yeah, I mean, it's the regular stuff that we say if you want to have a healthy lifestyle. So drink plenty of water, exercise. Of course, if your OB/GYN says it's
If
fine
you're
for you
able
to do
to, yeah.
so. Sleep well. I know sleeping sometimes is tricky during pregnancy. You wake up to pee a lot. That's one thing you'll notice. But sleep very well. Eat as hell as I said. The first trimester, I was just telling you guys before we started shooting. I'm usually someone who eats very healthy, but I was just craving
Carbs,
carbs,
right?
pizza,
Yeah.
pasta. Honestly, for me, the mentality was survive it until it passes. Now
Yeah.
I'm back to my salads, my grilled chicken.
Yeah.
I'm back. I'm back.
Now you're able to digest these things. And
Exactly.
all of these things give you like a healthier skin glow, basically,
It's
during
true.
pregnancy.
True.
Okay.
True.
Okay.
Okay. Can't wait to
طيب.
get there.
You are glowing.
You are يا Rusha, you are. طيب. Okay, I think that brings us to the end of the episode. Yani, we wanted to keep it short today because we're shooting with, Yara and Samar, both of them. It's pretty late and we don't want to keep the mamas up too long. But Samar, is there any last piece of advice that you want to leave with expecting mamas?
I mean, there's a lot of pressure. Don't do this, do that. Try to enjoy it. I mean, I'm still going through it, but a lot of women who actually gave birth and have babies now, they tell you enjoy pregnancy. You're gonna miss it. I don't understand how, but apparently you do miss it. So do enjoy it. I think it's a beautiful period. You're bringing a life into this world, and this is something I'm really proud of. Try not to panic about body changes because a lot, I know I'm one of them. A lot of women oh my god, am I going to get stretch marks? How am I going to gain too much weight? I mean, yes, it is scary, I'm not going to lie, but everything has a solution. We can manage. Just enjoy it, relax, and then we deal with it later.
Happy, healthy. That's the important thing.
Yeah.
Yeah.
Yeah, عن
And
جد.
if you have more questions, you can of course
Yes,
drop.
absolutely. Either you can message Dr. Samar directly on her Instagram page, on their podcast as well. Her and her colleague have a great podcast. They're touching upon pregnancy tips and tricks throughout the duration of Samar's pregnancy, I hope.
I think my co-host will kill himself, but probably. No,
Or
but you can also leave a comment on this
yes,
podcast
on
that
this
we also love and
podcast.
watch.
Yes, yes, أكيد. And Samar, we're so excited, Kamena, for both you and Diara. You're very, very close to each other. So Kamena, inshallah, we'll have you back on after pregnancy to understand what your tips and tricks are postpartum.
For
Um,
sure.
but we're really excited for you to have joined us today again. And like Yara and Samar said, you guys, feel free to drop any of your comments or questions below, and Dr. Samar will make sure to get back to them. And as always, come right back here in 2 weeks for another episode of Can We Discuss with Yara and Petra. Thanks,
Thanks,
everyone.
Thank you.
everyone.